most of the nursing home deaths happen to be in Democrat-run filthy states. Whitmer, Newsom, Cuomo, Kate Brown of Oregon, and Jay Inslee of Washington State. Now, isn't it funny that it would seem most of the nursing home deaths at a large percentage or large group happen to be in Democrat-run filthy states? It would seem sort of weird and sort of a pattern here. What's the pattern? You see, when you look at stuff, maybe perhaps let's take it in a historical perspective. When you're doing a research on anything, and if you have a hypothesis, you look at what sort of patterns can you sort of tie your hypothesis into. My hypothesis is that it would seem on the base level that Democrat-run states have it out for, let's say, the elderly somehow. Maybe it's a coincidence. I don't know. So therefore, I would have to do more research. So this is your fifth governor right here, who is tied to nursing home deaths at a large percentage. Is Jay Inslee the next Andrew Cuomo? Washington State offered funds to nursing homes to accept COVID patients. Nursing homes that admitted the COVID patients were offered Medicaid funds. Oh, government funds now. Interesting. As bombshell revelations are revealed regularly regarding New York Governor Andrew Cuomo ordered to send COVID patients into elderly care facilities and the subsequent cover-up on the number of related deaths, questions are now being asked about other Democrat governors who followed in similar plans. It was revealed in November that Washington Democrat Governor Jay Inslee's Department of Social Health and Services issued directives to transition COVID-positive patients primarily to alternative settings, with nursing homes being the primary strategy in order to create capacity for hospitals. Imagine that. Early on, they said we need to flatten the curve. We don't want to overload the medical system, the hospitals. That never happened, ever. Hospitals may have gotten to 90%, but they never got to 100% where they had to push people out. So what was the reason still behind sending those elderly people into elderly care facilities? There was no reason for it. But why do it? Why do it in a state where it's overwhelmingly going to be Democratic run as far as the political party? So what gives? Nursing homes that admitted the COVID patients were offered Medicaid funds. This is from some document, Aging and Long-Term Support Administration, Department of Social and Health Services. Hospital discharges to nursing homes. Dear nursing home facility, home administrator. The ongoing COVID-19 break caused shifting priorities, blah, 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 blah. We have critical need to create capacity in acute care hospitals to serve those who need emergency and intensive care during this ongoing outbreak. Okay. If these elderly people needed this care in an emergency room setting, then why send them back to a home? That doesn't make any sense if you're trying to save lives. It would make sense if you're trying to, dare I say, end those lives, if you will. Primary strategy to create capacities in acute care hospitals is working with the participating patients and families to transition to nursing homes. Once in nursing homes, home and community services staff will work the eligible individual and their family to transition to a permanent home and community-based setting of their choice. Nursing homes that admit these patients will receive a $100 add-on to the Medicaid nursing home rate for a period not to exceed 6 months. Resident-specific approvals of this enhanced rate will be provided upfront for billing purposes. Now look at this. These homes that were given money to taking these people who were obviously sick with COVID-19. But why would you do that? Money. And it says it right there. Money was the key, dare I say, motivation. Interesting. We know that COVID-19 outbreak continues to have significant impacts on our nursing homes, and we appreciate your willingness to partner and collaborate to meet this emergent need. Sincerely, Candace Gehring. Oh, what an unfortunate name. Director Residential Care Services, DSHS, Transforming Lives. Right to the grave, apparently. The letter was dated almost 3 weeks after the virus outbreak in Washington state swept through nursing homes in Kirkland, killing the majority of residents. As a result of the spread, Washington was the initial epicenter of the virus in the United States. And it was there, boys and girls. It appears that the elderly who contracted the disease, but who no longer were in the need of acute care, were eligible to transfer to these alternative facilities, even if they were not prior residents. Then home and community services staff would work with the eligible individual and their family to transition to a permanent home community-based, which meant these patients and families could select an elderly care facility that they were not previously a resident of. A week before the letter was sent, Inslee was already issuing proclamations recognizing the need to protect people aged 60 and older from the virus, which begs to question why a department under his authority was asking for nursing homes and care facilities to take COVID-positive patients. There indeed, yes. Then why take them when you know this early on was going to be a bad thing? I don't know. Let's ask Miss Gehring that question. Alternative settings could have been local hotels or other facilities that would have not posed a risk to elderly residents. Exactly. Put them in a room sequestered from everybody else who would still, I guess, have their family take care of them. Why put them in a home with other people with pre-existing conditions? Because you just don't go into these homes without a pre-existing condition or a comorbidity. That. Interesting. King County bought and rented hotels to be used as quarantine facilities for area homeless. Occupants of area homeless shelters were spread around the county to implement distancing measures and thereby reduce contact. In March 2020, an Army field hospital was established at CenturyLink, now Lumen Field, for non-COVID patients was redeployed elsewhere on April 8th due to a lack of patients. Why not send them there? Why send them to elderly facilities inside? Money. And we already know that. They got $100, I think, per day or something like that. Their per diem was $100 per patient. Of course, these nursing homes would take them for $100. And if they died, I guess, oh well. Inslee expanded directives he made for nursing homes to long-term care facilities on March 26. In his proclamation 20-36 on March 30th, almost a month after the outbreak in Washington nursing homes, Inslee mentioned, in anticipation of hospitals being overwhelmed, a need to waive portions of licensing statutes and rules. So healthcare facilities could provide alternative beds for COVID patients. Newly revealed documents obtained by the Post-Millennial through public disclosure requests showed the Department of Health knew of the risk posed by the virus to elderly and instructed long-term and elderly care facilities on mitigating risk to patients even before the request for the facilities to take infected patients was made. And we see all the documents. Wow, there's a long report from the Post-Millennial. Let's go to the end here. As a source told the Post-Millennial that at the multiple long-term care facilities they worked at, as well as many others, testing was not available. According to the source, the staff was doing the best they could to separate and quarantine those with symptoms. According to the Seattle Times, nursing homes, assisted living facilities, and adult family homes account for the state's now almost 5,000 deaths. Yet as February data was still being inaccurately reported regarding long-term care facilities. And it seems those inaccurate reports seem to be, rife in Democrat-run states. And again, this just goes to show you, everyone here, that it would seem the pattern is that Democrats don't give two shits about the elderly with comorbidity, with COVID going into elderly care facilities, because the guys was, oh my God, the hospitals are going to get overwhelmed and flooded with patients, which never happened. It got close, but never happened. And they also offer them hundreds of dollars per patient, possibly per day, to take in these elderly patients into these homes. So what does this say? Oh, what's going to happen? Nothing. That's what's going to happen. We all know it's out there. And in the town hall report here on the right-hand corner is Washington Governor Jay Inslee single-handedly responsible for America's COVID outbreak. Possibly it happened in New York and Washington State. Now you have to kind of be, dare I say, fair to Governor Jay Inslee, even though he would never be fair to me or any Republican, dare I say, conservative. It did happen. It was early on. However, it didn't happen that way. As far as the spread happened, possibly it started in Washington State and it moved out. But it is, to be fair also, that Governor Jay Inslee's reaction by putting the elderly in these facilities with COVID-19 without the proper, PPE, the testing was ill-advised and wrong. Looking back, I guess, Monday morning quarterback here, looking back at going, now, this isn't good. Is Jay Inslee guilty of anything? Possibly of being an idiot and a Democrat douchebag. But let's look at Governor Whitmer and Cuomo. They specifically put these elderly patients with COVID-19 into these facilities, possibly knowing full well that this was going to kill many, many people. And just goes to show you that if you really think Democrats care about your life, care about your family, you're insane and you deserve nothing but scorn and ridicule. Laszlo out.